We'll talk today a little bit about gastrointestinal issues, and it's a very common problem. Patients come into my office all the time. They have gas, bloating, constipation sometimes, or diarrhea, and they have trouble with foods or food sensitivities, and their gut gives them problems. So first of all, gut health is extremely important for overall health. We know now, in the last 20 years, there's science showing that the gut, GI tract, communicates with the brain, first of all. And so people, even if they have things like anxiety, depression, sleeplessness, OCD, obsessive compulsive disorders, believe it or not, I will also check the integrity of their GI tract. Psychiatrists, unfortunately, don't typically do that. They just put them on antidepressant. I will try to look at root causes. So we'll try to look at their gut to see if they have problems. If a person has joint pain, joint troubles, nervousness, sleeplessness, gas and bloating, I will almost always check them for gut health, including a specialized stool test that we do. We send it out to a lab that looks at their bacteriology, and it looks at their gut microbiome, which has to do with the balance between the friendly and less friendly or unfriendly bacteria. We also may check them for something called intestinal permeability problems, or leaky gut syndrome. And this is where the gut, the cells that are attached to the GI tract in the lining, instead of being close together, which they should, start to separate like that. And that causes more food sensitivities or food reactions, can even cause autoimmune diseases. When I see someone with an autoimmune disease of varying sorts, whether it's Crohn's disease or even Hashimoto's thyroiditis, rheumatoid arthritis, which are commonly autoimmune diseases, I may check them for food allergies, food sensitivities, and gut integrity. Because when we have this separation, this leaky gut syndrome, it leads to a reactivity of the body. The body sees these large, what's called macromolecules, large proteins that get absorbed abnormally, and then it makes an autoimmune reaction against it. So there's many ways of healing the gut. We work with that. We work with each person individually, and we have great results. I mean, GI problems are very common, and unfortunately, a lot of the medicines that are used today in conventional settings, such as like omeprazole, for example, or the PPIs, which are these proton pump inhibitors, which are commonly prescribed, they're somewhat counterproductive. There's literature showing they may increase our risk of various cancers, believe it or not, colon cancers and gastric cancers and perhaps some others. These drugs were not meant to stay on for long periods of time. They're, just short periods of time might be fine. But patients are on these for years and years and years, I found. And they're, once again, not getting at the root cause. Once you remove the inflammatory foods, if you identify these, once you heal the gut with different probiotics, different nutrients such as glutamine and other inulin and other things that we use here in the office, we find that a lot of the symptoms just clear up completely. So it's very exciting to make small changes can have great results. So thanks for listening. I hope this was helpful for you today.